2-year-old with quote-unquote croup. She is awake and alert with no respiratory distress, but she has an audible barky cough.
All right, you have your scenario. Let's go ahead and get started. Grab your cheat sheet, Broslo tape, whatever you've got. But if you're using Broslo or Hand-Tevi, remember, red goes to the head and head to the heel. You can see that she falls into the yellow zone. And now to Scott for your quick tip.
So when it comes to croup, remember the vast majority of kids with croup are cute. But occasionally you can be sick enough with croup to wind up in the pediatric ICU, or even worse, not only to be in the ICU, but to be intubated for your croup. But happily, it's incredibly rare. The vast majority of kids with croup are cute. And if you've got a little croupy kid, what do parents do in the middle of the night to cure croup? Is one of two things. Either A, they take them upstairs, put them in the bathroom, turn on the shower. Or B, even better, they bring them to the ER. Because parents present saying, "You're gonna think I'm nuts, but I swear to you, my kid was barking like a dog, and now they're all better." And that's true. Because what happened in between the house and the ER was simply a cool mistreatment, compliments of God. So when they hit the ER, it's poor form to tell them to go back out in the parking lot. So what did we do up until recently? Some of y'all remember was the mist tent, otherwise known as the croup tent, otherwise known as the first scourge of pediatric existence. And if you come across a croup tent, what should you do with it is simply take it out back and burn it in effigy. As there are multiple studies showing croupettes don't help croup. Problem number one, they don't help croup. Number two, the kid's always trying to get out. Number three, mom or dad's always trying to get in. Number four, the sheets are saturated. And remember, you want to keep kids pink, warm, and sweet, not cold, wet, and purple. So most hospitals, especially in the ER for croupy kids, will give some variation of blow-by cool mist. However, check this out. In a recent study that you can actually use, croupy kids hit the door randomized into two groups. Half of them immediately got blow-by cool mist. Half of them immediately got sent to the waiting room and got absolutely nothing at all. And you'll be happy to know that those who hung out of the waiting room did just as well as those who got blow-by cool mist. So with that in mind, if you're cute, you're cute. But if you're cute, what many people recommend is whether it's urgent care, pediatrician office, or the ER, you're sick enough that mom or dad actually bring you in for croup. When they hit the door, give them steroids. Because it's viral, meaning antibiotics are not needed, but the problem with croup is you swell. And you swell at the bottom of your funnel-shaped airway. And at the bottom of the funnel, a little bit of swelling goes a long way. So when they hit the door, give them steroids. Because it helps with the edema, it helps because when they get home, they simply don't cough as much, meaning they sleep better, meaning parents are happier and the kid is happier. So croup begins with C. And if they've got a nasty croupy cough, giving them either a shot in the thigh or oral steroids, because they both work just as well. Either way, when you've got a crouper, when they hit the door, give them steroids.